A scary situation in the hospital with her mother prompted a changing careers for Pat Rullo, author and national radio talk show host, who now shares her research on healthcare and hospital safety tips. She recently spoke at the County Human Resource Center and Ashtabula Senior Center. She also talked with GreatWave Communications.
My name is Pat Rullo, and I am the host of a radio program called Speak Up and Stay Alive. It's a nationally syndicated radio program originated in Cleveland, Ohio, and it's all about patient safety, how to survive a healthcare or hospital experience, and it stemmed from my book called Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide.
And so, how did you become an advocate for people when they're in a hospital or they have loved ones in a hospital?
That's a really great question, because who would want to talk about something like this, right? My mom, several years ago, back in 2008, she was 78 years old, working in a bridal salon, and she fell at work and crushed her shoulder to the point that it couldn't be repaired, it had to be replaced. And during that hospital surgery, she was having a heart attack that then went undiagnosed for the next 9 hours.
Wow.
That left her in the hospital for about 4 months. And so once I realized what happened to her, which was the very next day, I decided there was no way I was going to be able to leave her there by herself. And so I stayed with her around the clock pretty much for the next 4 months. And some of the things that we experienced, not only my mom, but as a family, the errors that happened in the hospital was just such a huge event and a life-changing event for us that one day I just realized I had to do something about it. I couldn't no longer be angry about it. I figured, let me get it out of me and put it into words. So it prompted me to write the book. I had been a public speaker and an author in the insurance industry, so I felt like I knew how to write and felt like I knew how to communicate to people. And so I just translated the message from insurance to this very important topic of how to stay safe during a hospital stay. I want to talk about Speak Up and Stay Alive. That's the name of this book I wrote, and I always tell people I had to write this book. And that sounds like a really weird thing to say, like, why would anyone have to write a book about speaking up in a hospital? Well, let me tell you quickly a story about my mom. In 2008, my mom was a very happy, healthy young lady. She was working at a bridal salon. My dad had passed away many years ago due to colon cancer. And so she was working and carrying a veil from the stockroom into the showroom, because there was a young bride who wanted to see this particular veil. And as she stepped across the two rooms, there was a threshold. There was a 2-inch building code violation that protruded between the two rooms. And let me just say that my mom was the youngest gal working there. So now we had people well into their 80s that had to remember to walk over this big stoop here. One day she missed it. And as she missed it, she fell forward, and in order to avoid hitting her face, she blocked the fall with her shoulder.
So did you do other research before you did the book?
Yes, I did. Actually interviewed hundreds of doctors, nurses, patient advocates, and just hours and hours of research in order to write this book. So she went to the shoulder surgeon and said, we're going to do a procedure that had only been approved by the FDA for 4 years. So it was a pretty young procedure, and it was called a total reverse shoulder replacement. They would take out the entire shoulder and the arm up to here and put in a plastic ball and a metal socket and reverse it from what is normal, the way it normally goes. Wednesday evening, the phone rang about 7. It was the secretary, and she said, can you bring your mom here tomorrow morning at 5 a.m.? Okay. Meantime, though, my mom is saying, I don't feel good, I don't feel good. She didn't want to eat, she didn't look good, the arm's getting bigger and bruised. My mom up at 4:30, she still says, I don't feel good, I don't feel good. Brought her to the hospital. One of the anesthesiologists, there was the head anesthesiologist and the assistant, the intern, checked her blood pressure, and it was 80/50.
Oh my Lord.
Kind of low, kind of low, kind of low. And I saw exchanged glances where the young anesthesiologist looked like, but the head anesthesiologist, she said, no, keep that under wraps. So they went ahead and did the surgery. 10:15, the shoulder surgeon comes into the waiting room to find me, and he said, we're all done. You can see your mom in 45 minutes. So the book's not about my mom, but it really is because of her. And I decided to put kind of a in-your-face cover. So now folks can actually bring this book to the hospital with them. They don't even have to read it. If you bring this book to the hospital with you and simply lay it on the tray table anytime a doctor or nurse walks in, now they look at the cover and say, what is that? And it's your opportunity. It opens up that line of communication where now as a patient, you might have normally felt afraid to speak up and say, would you wash your hands, and ask those kind of questions. But now the book is kind of a nonverbal cue or an introduction so that you could begin that conversation to say, I'm concerned about healthcare acquired infections. I'm concerned about medication errors, malnutrition, and all the other 17 different topics that I highlight in the book. That same morning that they did this surgery, a doctor who I didn't know found me in the waiting room. He grabbed my arm and he took me and he pulled me and he said, come with me. And he brought me to a small conference room and he handed me a manila envelope. He handed me a folder and he said to me, this stinks and you need to do something about it. Like, okay. I was very frightened to open this up because I had no idea what would be in it. As I pulled it out, there were 4 EKG rhythm strips. You know when you have the EKG, it's got the squiggly lines? Well, again, I'm not a doctor, so I didn't know what it meant. But the more I looked at it, the more I realized I did not have to be a doctor to know what this meant. Because in the left-hand corner, it said the time, 10:53 a.m. That was the time she just got out of shoulder surgery, had her name, and in English words, it said, acute myocardial infarction in progress, which means heart attack in progress. And I pulled out the next one at 1:20, and the next one at 3:30, and the next one at 4:30, and they all said in English, heart attack in progress. Where was everybody that they didn't see this? So this was a missed diagnosis. And it's becoming, the systems are becoming more and more fragmented lately, and doctors and nurses are overworked and understaffed. So it's now our responsibility as the patient to feel like we can speak up, and yes, it is frightening to speak up. As soon as you see someone walk in with that white coat on, all of a sudden you become reduced to mush, and it's like, well, I'm not gonna ask him or her anything. But when in fact it really is our right, and if you wanna stay alive, you really do have to speak up.
You mentioned the thing about understaffed. Is that more of a problem now? That you have nurses or aides that are looking after X number of patients and they have a hard time taking care of everybody?
And you just hit it. That's exactly what's happening. You've got a nurse, you might have one RN on a floor, especially in a rehab facility, those rehabilitation facility and nursing homes, and they're there now to look after 12 or 15 seriously compromised patients, and then they're working around the clock because somebody else may be called off. And just think, do you really expect that there's not going to be an error when one person is looking after 12 people and they're working for 18 hours? You can pretty much expect that they're human, and errors are going to happen. I thought that I knew how to write and I know how to speak. And one day I thought, I gotta get this out of me and write this book just to save my sanity. And it ended out being so well received that it morphed into speaking events such as this. I've spoken at the Cleveland Clinic to hospitals and doctors, so they want to hear this too. They need to hear this message coming from patients. And it also prompted me to do the radio show.
I kind of think from my experience with hospitals too is that sometimes the medical professionals, they know all this stuff. They do it every day with different patients, and they don't always realize that this is all new for you or your family member as well.
That's so true. I think hospitals need to realize that and create a culture within the hospital walls that now allow that patient to have a voice and to have a choice and to feel comfortable speaking up. And you're exactly right. You know, the doctors and nurses, they know their job, they're there every day, and you're just a heart attack in room 306 or the knee surgery in 202, and you're not an individual anymore. And that's where we have to, as a patient, have to stand out and in a positive way. And that's how I think that if you are somewhat educated and show them just visually, just by walking in and laying this on the table, that gives them that sign and that cue that you are different and that you are going to speak up and they're going to treat you a little bit differently.
Can you give me some examples, like, first of all, when you were in the hospital with your mother, what kind of things happened that worried you, shocked you, and how things should be handled? You mentioned something about washing hands is one thing.
Absolutely, and that sounds like a crazy thing, but healthcare acquired infections, hospital acquired infections is one of the leading causes of death in the United States, beyond breast cancer and prostate cancer combined, behind even ahead of car accidents. But people don't realize that, and you don't hear about that. People get things like MRSA and c-diff and all kinds of bacterium in the hospital simply because healthcare providers are not washing their hands properly, or the housekeeping staff isn't cleaning the room properly, or visitors come in and spread those germs. So when a doctor or nurse walks into your room and says, "How are you?" Well, I would sure say, "Would you please wash your hands before you touch me?" Because they had to have used the doorknob to enter. And germs live in the hospital, they fly around, they live there, and so you can pretty well bet that germs are everywhere, including lab coats and privacy curtains and those kind of things. I had a cousin that was in hospice. He was dying, and he clearly had MRSA. There were patches on his skin that were red and crusty and red. And the folks at hospice told the family, "Don't worry, those are spider bites." And I'm looking around like, where are these spiders that are biting this man like that? So we need to know what MRSA looks like. The second one I want to talk about is c-diff. Have anyone experienced? No. It's the letter C, D-I-F-F. You'll know you have this, and you'll know if someone in your family or someone you're visiting has this, if they have diarrhea like none other. Okay, it's not just one, oops. It's diarrhea that basically ravages the intestinal system and causes dehydration. Many people die of c-diff in the hospital. Yes, it spreads, and I'm going to talk about that. I was just at a presentation last week, and a gentleman raised his hand. He said, "My wife just died of c-diff in the hospital," and they put death, natural causes. And you know why they did that? Because c-diff is considered by Medicare on the list of never events, where it should never happen. And if it does happen, the hospital doesn't get paid for it. So do you think they're going to put c-diff as the cause of death? Because then they won't get paid. So if you are ever in a situation where somebody has got diarrhea that's very, very bad in the hospital, that needs to be your ding, 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 red flag. Does that person have c-diff? How does it get spread? Wow. The answer is like a third world answer. When people don't wash their hands after using the bathroom. Now, do you think, can you even imagine that that's a problem? Well, yeah, it's a problem. All you have to do is go into a public restroom. Next time you're in a restroom, hang out for a little while and watch how people either don't wash their hands or and they're out the door, okay? Well, gosh, that's not the way to wash hands. I mean, you need to wash long enough. You need soap. Soap doesn't kill anybody. Soap just lifts the bad guys up, and then you need the friction. Not on the palms, but also on the tops and between the fingers, and then make sure the water rinses down into the sink and not back up onto your clothing. We always say sing happy birthday once or twice. So as you're, make sure you do it long enough. So now people in a hospital use the bathroom, don't wash their hands, and this is how c-diff spreads. Another thing about c-diff is a really smart little bacteria. If it feels threatened, it becomes dry and crusty and can lift up and become airborne. So now imagine it's floating in the air and we've got doctor not washing his lab coat, walking around, and as you can see, just as you're walking, just the air moving about can cause the bacteria to fly around and fly about, and now the bacteria is landing on everything. Now the only way you can get rid of c-diff on a hard surface is bleach or bleach wipes. And you'll notice at the hospital, right on the sink, they should have the container of those of disinfecting wipes. They should. If they don't, ask. Say, I would like a container of wipes. I bring my own. I bring a container of like Clorox bleach wipes with me anytime my mom goes to the hospital. And I go in like hazmat. I'm like, all right. No one touch anything. Mom, don't. You're not laying down yet. You know, short of putting the caution sign in yellow around there, I put on a pair of gloves and I start cleaning the room systematically, because think about housekeepers. Let me ask you a question. What do you think is the germiest object in a hospital room? Bed?
In the bathroom.
Bathroom. But I've got a surprise for you.
Remote control.
The TV remote. Yep. Actually, the bathroom is probably one of the cleanest because they know we've got to clean the bathroom. Now, why would the TV remote be the germiest object. Everybody uses it. Yep, and the nurse. And if the only way you can get rid of a c-diff bacteria is through bleach, and think about the housekeeping staff. Now these people have what, 10, 15 minutes in your room? It's a lot of cleaning to do in 10 or 15 minutes. They are the least paid. They have the least training. They could maybe work at McDonald's yesterday, and now they're in your hospital room cleaning. The least paid, least respected, least amount of time. Do you really think that they're now with a bleach wipe?
No. Never.
No.
I've been there.
Yeah. And so this is a nasty little guy. So when I go to the hospital with my mom, I put my gloves on, and when I clean the remote, I clean it. Throw out that wipe. Don't try to use one wipe for the whole room. This is not the time to be frugal. Use the whole darn thing, whole container. And then I bring baggies with me, and then slip the remote into a baggie. And this way, if it falls on the floor or anything, you can clean it. In fact, I have little canisters there on the table. There's 10 canisters in the tube, and I think it's like $5, and you get 10 of these things. And now you can clean your remote, slip it in there, and it keeps it clean. So healthcare-acquired infections is my #1 topic because it's something we can do something about. You can ask your provider to wash their hands. Medication errors, that's another big one. So if you don't know what medications you're taking, how do you know that the medications are correct for you? Medication side effects is another big one. A lot of folks experience side effects from their medications because they don't know what the side effects should be. And then the doctor or nurse prescribes another medication to kind of quell that symptom, and then you begin this giant cascade of medications when in fact it could just have been a side effect that you're experiencing. So those are some of the things you can do something about. Make sure people wash their hands, know what your medications are, and yeah.
So does that mean that everybody should have like a list of the medications that they have, or grab them and take them to the hospital with them, or something like that?
Yes, I think it's very important to have a medication list that you should even keep on your refrigerator, because imagine if something happened to you at home and EMS had to come into your home, how would they know what to look for? And the refrigerator is the place where they know to go to look for those kind of things. I always suggest that people pack a hospital bag ahead of time. Keep it stashed in your closet, have the list of your medications, a copy of your insurance, maybe a canister of disinfecting wipes, an extra pair of eyeglasses, all the things you might need during a hospital stay.
Like power of attorney papers, that kind of stuff?
Excellent. Advanced directives is extremely important, those kind of things, so that when you enter the hospital, they typically ask you, do you have advanced directives, do you have a power of attorney? And a healthcare power of attorney is the primary one that you want. Because if you can't speak for yourself and you don't have an advanced directive, you don't have a healthcare power of attorney, now the hospital looks around and says, who's making the decisions here? And if nobody has the legal right to make that decision, then they assign it to the probate court, and some random person is now assigned to look after you and make those healthcare decisions, and they're getting paid by you. So now they have a dog in the race, and do you really think that they're necessarily going to always do the right thing for you if they're getting paid by you? So a little drop of ink on a piece of paper that costs nothing to do, or maybe $25 through an attorney, I would say would be on my list of to-do today. Or let's say that you're going to go into a hospital at some point in time. Build a little network of advocates. So maybe you'll be there from 12 to 6, and a brother or sister from 6 to 12, and the lady across the street, the neighbors, or someone from a church. Make sure you've got enough people that will be there almost round the clock, because especially during shift change times, when you're shifting one nurse to another, that's when a lot of miscommunication happens, or discharge from the hospital, or when you're going from one facility to another. That's when you need an extra set of eyes and ears and even a mouth to be able to speak up for you and say, hey, what about this? Or are we going to continue with this medication? Because as a patient, you're not going to be maybe cognizant or feel well enough to do that. So I would have those conversations with family and friends ahead of time and say, hey, if I go to the hospital, who's coming with me? And read the book so you know what to look out for.
So you should probably have somebody there almost 24 hours a day with somebody.
Sadly, yes. Yeah.
Now my thought on that, I'm sure other people would be, man, those hospital bills are high, and you still have to be there to take care of things.
Sadly, yes. Yeah, that's not a great comment, is it? But if you value your life, I would say yes, somebody needs to be there just to watch and make sure that things are happening correctly. But your advocate could say, especially if you're having surgery done on one of two parts, like you've got two knees and two ears or two
Right.
eyes or two arms, make sure that somebody circles the right spot, you know, in on a black indelible marker that's not going to wash off, and make sure that that happens ahead of time. Again, know what the medications are, be able to speak up about that. Another important thing is your diet, the nutrition in a hospital. You know, many times you or your patient might be on a low salt diet or a special diet, and it doesn't necessarily translate to the nutrition department, and they could be giving you foods that exacerbate your problem. That's something else to pay mind to. Physical therapy is another very important aspect. Most people that are in the hospital for a period of time eventually need some kind of physical therapy or occupational therapy so that they can regain their ability to walk or move or speak. And very often that doesn't happen with regularity on a daily basis. And so again, that's where an advocate can come in and say, hey, so-and-so didn't get their physical therapy today. I know that firsthand. It would go day after day. Nobody would come in to do physical therapy. How is my mom going to ever get out of the hospital if she's not walking? And sometimes it helps just to know what words to say. Then you can go to the front head nurse and say, you know what? The doctor prescribed physical therapy. Medicare is getting billed for physical therapy. Medicare is paying for daily physical therapy. Is this considered Medicare fraud? And believe me, as soon as you are intelligent enough to say Medicare fraud, you will get someone in your room every day to do physical therapy.